My A1C results are in, guys. I just did it last week. Guess what it is? So I had my A1C done last week at the hospital. My doctor decided to do it every 6 months or so because I reversed my diabetes diagnosis. She's not doing it every 3 months anymore. She's like, okay, well, just push it out to every 6 months. So last week was my 6 month mark. And she did that to see if anything would change or if I would cheat or slack off. She's always trying me, but I always prove her wrong. So I'm going to share these results with you and some of my past results today in this video as well. And I'm also going to go over, A1C, what it is, why you do it, how you do it, the pros and cons of doing A1C. All the things you need to know, because there are a lot of people that are diabetics that don't know anything about this. So we're going to go over that as well. I know you want the results, but we'll go over this. Once I go over all that information, then I'll give you guys my results. And I'm going to go over my past results and my current results. I'm going to go back to, I think, 2022 or something like that. So for many of you that have seen my videos and have any doubt that I know what I'm talking about with regard to foods, techniques, and or advice I provide on my channel, you can be rest assured today that you're getting the right information to get you to your goal, which is reversing your diabetes diagnosis like I have. There's nothing better other than proof, right? Everybody's out there talking about this, talking about that. I'm showing you my proof as a diabetic as well. So my name is Mr. A1C. My goal of this channel is very simple. Because I'm a former Army combat medic, I pursued a medical degree as a civilian and happen to be a type 2 diabetic as well, who has also reversed my type 2 diabetes diagnosis. I feel that I have a well-rounded understanding of how I can help you do the same with the videos and coaching that I put together for you. So let's get into it, guys. So let's go over what an A1C test is, right? So an A1C test calculates the average level of glucose or sugar in your blood over the past 3 months, and it's always presented as a percentage. A higher percentage indicates higher average blood glucose levels. So how is the A1C test used? The A1C test is a straightforward blood test used by healthcare professionals. It helps in several ways. It can detect prediabetes, a condition where blood sugar levels are higher than normal but not high enough to be diagnosed as diabetes. That's where initially mine was detected years ago. It aids in diagnosing type 2 diabetes, a disease where your body can't properly regulate blood sugar levels, guys. If you already have type 2 diabetes or type 1 diabetes, it helps monitor the effectiveness of your treatment by showing the average blood sugar levels over the past 3 months or so. If your A1C level is high, you and your provider may need to adjust your treatment strategy. In essence, the A1C test is a valuable tool for diagnosing, managing, and adjusting treatment for our diabetes, guys. So how's this test perform? Many of you know, and maybe some of you don't know, and that's why I'm going to go over this information first before I go over my results. Just hang out till the end, guys. You're going to get all the results. You're going to see the before and after of my specific information, because I talk a lot about diabetes and what to do and how to fix it, but you guys don't know me from Adam, right? So this is how I establish my credibility to you guys, to show you that I've gone through the same things you guys are going through, and this is how I'm combating these things. And yes, it's working, so I want to share it with you. So how is A1C performed? A healthcare provider can take a blood sample in 2 ways: from a vein in your arm, which is then sent to a lab for analysis, which is what I did last week. This is the most common and accurate method. So I went to the doctor, to the lab, and they took my blood, and that's how they did it. And what was great was my most recent medical information I can pull up online. So the same day it happened, I had my results. I was able to pull it up online. Although my next appointment for my doctor, I believe, is in October, so she's not going to go over it with me till October, but I can see it now. You can do a finger prick as well, with results available within minutes. This method is less accurate though, guys, and mainly used for monitoring, not diagnosing. So there are other names for an A1C or HbA1c test. It's hemoglobin A1c, that's one way they call it. It's called an HbA1c. They call it an A1c. They can call it a glycated hemoglobin test. Also, they can also call it a glycohemoglobin test. So these are several different ways that they refer to this test by. So what is blood sugar? We all know what blood sugar is because we're diabetics, but some of us don't. So glucose, the body's primary energy source, primarily derived from carbohydrates in meals and drinks, right? The blood transports this glucose to all body cells. Several bodily functions, including the hormone insulin produced by the pancreas, maintains a healthy blood glucose level. Persistently high blood glucose levels, which is called hyperglycemia, and a high A1C results typically suggest diabetes, guys. This condition arises when the pancreas fails to produce enough insulin or the body doesn't use insulin effectively. So, and an A1C test is just not a check of your blood sugar. It's a check of your blood sugar over a 90-day period span. And that what that tells your healthcare provider is how well you are doing in controlling your blood sugar on a day-to-day basis, right? So you can have an example. What I'll share with you is this. I did my blood sugar last week. It wasn't a fasting glucose, so I wasn't worried about it. And I did it, I don't know, maybe it was 11 o'clock in the morning or something like that. When I did it, my regular blood sugar that day, when they did take the blood, my blood sugar was 114, I believe, which is high. We shouldn't be over 110. But the reality is, the doctor wants to know, well, that's great. Maybe you just ate, and that's why that may be a postprandial blood sugar. Maybe it's 2 hours after you ate or something like that. But I want to know, have you actually been doing what you're supposed to do in my absence where I can't see what you're doing? And that's where the A1C comes in. Have you really been doing what you've been doing in the last 90 days, or are you just giving me lip service, right? So my doctor doesn't care about my blood sugar at any given time. She cares about how I control my blood sugar over the length of the 90-day period. And with me, it's more than 90 days now. It's 6 months because she has reversed my diabetes diagnosis, but she continues to monitor me because she doesn't trust me, which is okay with me. So when do you need an A1C test? If you have diabetes, A1C tests are recommended 2 or more times a year to evaluate your management plan. So for me, it's 2 times a year. It used to be 4 times a year. If you're at risk or display symptoms like intense thirst, frequent urination, blurry vision, and or fatigue, a healthcare provider may order an A1C test for diabetes screening or diagnosis. Risk factors include family history, gestational diabetes, that means when you were pregnant, obesity, inactivity, and age over 35. So the details of the test. How is the A1C calculated, guys? The A1C test, also known as the hemoglobin A1C glycated hemoglobin glycohemoglobin test, is a simple blood test that measures your average blood glucose level over the past 3 months. It is used to diagnose type 2 diabetes, detect prediabetes, and assess the effectiveness of your diabetes management plan that the doctor has put you on. So the doctor uses this to tell whether or not it's working. That plus your compliance. Are you actually doing what you're supposed to do? The test works by measuring the amount of glucose that has bonded with hemoglobin in your red blood cells, which live for approximately 3 months. A higher A1C percentage indicates higher average blood glucose levels. So do you need to fast? No, actually my blood sugar reading at the time of the test was about 114, like I told you guys, which is not good, but it doesn't mean I'm a bad diabetic. It just means that I could have just eaten and that was my spike, right? Doesn't mean that I'm not controlling my blood sugar over a period of time or doing what I'm supposed to do when the doctor's not around. So what should I expect during the A1C test? Well, during an A1C test, using a vein sample or blood draw, you'll be seated with a phlebotomist, and that person's going to search for a suitable vein, typically found on the inner inside of your arm near the elbow. Once located, the area is sterilized. A small needle is inserted to collect a blood sample, which many of you are already familiar with, causing a slight prick. The blood is then drawn into a test tube, and once enough is gathered, the needle is removed and pressure is applied to the site to stop the bleeding. A bandage is placed over the area, finishing or concluding the process. In the case of a finger prick A1C test, which is less accurate, a healthcare provider will request your preferred finger, clean it with alcohol swab, and prick the skin using a small needle, which is called a lancet, guys. A drop of blood is then formed and collected in a small container. So it's the same way you check your blood sugar every morning or multiple times a day. Very similar process. After sufficient blood is obtained, you'll be given a cotton ball or gauze to stop the bleeding. The results are usually available within minutes. Remember, this one is less accurate. This is not the one you want to rely on. Are there any risks associated with taking an A1C test? Blood tests, including A1C tests, are routine and vital in all medical examinations. These tests carry minimal risks, such as temporary discomfort or a small bruise at the blood draw or finger prick site. Any such reactions typically subside quickly. So what does the A1C test really mean, right? An A1C test outcome is expressed as a percentage, reflecting the proportion of hemoglobin proteins with attached glucose. A higher percentage indicates a higher average blood glucose level over the past few months. Specifically, an A1C of below 5.7% indicates no diabetes. 5.7 to 6.4% will suggest something like prediabetes. Anything that's 6.5% or higher may signify type 1 or type 2 diabetes. For those already diagnosed, an A1C test helps assess the effectiveness of the current management strategy, which could involve medication, insulin, blood sugar monitoring, and lifestyle adjustments. This test assists in deciding if any treatment plan modifications are necessary by your provider and yourself. It's crucial to remember that an A1C result is an average of blood sugar levels over several months and not a definitive measure of your overall health. A1C levels can vary over time, and individuals can take steps to enhance diabetes management and A1C levels if required. So A1C and estimated average glucose. So here's something different as well, the EAG, the estimated average glucose. Some labs provide A1C results as both a percentage and the corresponding estimated average glucose. The estimated average glucose conversion translates the A1C percentage to match the units used in personal glucose meters, namely milligrams per deciliter or millimoles per liter. Similar to an A1C, the EAG is a simple value representing the average blood sugar level over the past 3 months. For instance, a 7% A1C corresponds to an EAG of 154 milligrams per deciliter, which in turn is 8.6 or so millimoles per liter, while a 9% A1C equals an EAG of about 212 milligrams per deciliter or 11.8 millimoles per liter. So what's normal for an A1C, you might be thinking as I'm talking here, right? So for individuals with diabetes, a normal A1C is below 5.7. For those with diabetes, the ideal and healthy range depends on individual objectives, so everyone's different, and access to diabetes management resources. In collaboration, you and your healthcare provider will establish an A1C range as your target goal. So everyone's going to be different. It's whatever's going to be acceptable for you as a person, and your doctor will go over that with you, and which will likely change over time, obviously. Generally, the American Diabetes Association advises most diabetic adults to aim for an A1C of 7% or lower. However, A1C goals may be higher than 7% if individuals have a shortened life expectancy, severe hypoglycemia incidence, or inability to detect these episodes, or advanced diabetes complications such as chronic kidney disease, nerve issues, and or cardiovascular disease. Conversely, guys, healthcare providers often suggest that pregnant women with type 1 diabetes strive for an A1C of 6.5 or lower to minimize potential health risks for the fetus and prevent fetal microsomia. So what's fetal microsomia? Fetal microsomia refers to a baby's weight being in the highest 10% for the specified stage of pregnancy. So a big baby, oversized baby. Delivering a sizable baby can pose challenges, increasing the risk of vaginal injuries or difficulties in expelling or getting the baby out. If it's suspected that your baby is significantly heavy, over 11 pounds or over 10 pounds with diabetes, a C-section might be the most secure method of delivery. So mothers out there, if you're watching, this is something you should be aware of. If you're finding value in my channel, guys, and the videos themselves, please subscribe to the channel, comment on the videos, and share it with someone that needs help with their blood sugar, other diabetes like ourselves. Don't forget to participate in the community area on my channel as well, so we can all get to know each other. So let's talk about the dangerous level of A1C. What's a dangerous level of A1C, right? So the A1C test measures your average blood sugar levels over the past 3 months. Higher A1C levels can lead to complications like damage to the eyes, which is called retinopathy, kidneys, which damage to the kidneys, nephropathy, damage to the nerves, neuropathy. You've watched my other videos, you know about this, and digestive system problems, gastroparesis. It can also increase the risk of heart disease and stroke, guys. Keeping A1C levels below 7% can reduce these risks. However, other factors like genetics and duration of diabetes also will play a role. There's no one silver bullet that solves all of our problems, guys. There's a lot of things we have to be aware of. So how accurate is the A1C test? Is it accurate? The A1C test can sometimes be inaccurate, that means not accurate, due to a lot of factors. For instance, genetic variations or hemoglobin variations can affect the test results. Certain medical conditions and medications can also influence the test, making the results seem lower or higher than the actual average blood sugar levels. Errors in collecting, transporting, or processing the test can cause inaccuracies. Maybe the test has been tainted. you know, they didn't wash their hands or something, they weren't sterile about it when they were taking the blood sample. The lifespan and health of red blood cells significantly impact the A1C test, as it measures the amount of glucose attached to these cells. Any abnormalities in these cells can lead to a false A1C reading. So we just talked about hemoglobin variance as one of those issues. Some A1C tests may be influenced by specific hemoglobin types inherited from your parents. I bet you guys didn't know that. The most prevalent type is hemoglobin A, while other less common forms are called hemoglobin variants. These variants don't increase diabetes risk, but they can impact the test results, your A1C test results. Different labs have distinct methods for A1C testing on blood with hemoglobin variants. Common variants include hemoglobin C trait, predominantly in black people who's from West Africa, South and Central Africa, the Caribbean islands, and Europe. So I kind of fall into that category because I'm from the Caribbean. I was born in the Caribbean. So, and then there's hemoglobin D. The trait is more common in Chinese, Indian, Turkish, Brazilian, and some European populations. Actually, there's some crossover there with me as well, to be honest with you, so it's hard to tell. Then there's hemoglobin E trait, which is prevalent among Asian Americans, particularly those of Southeast Asian descent. Hemoglobin S trait is most common in black people and Hispanic Americans. So if you suspect having a hemoglobin variant that might affect your A1C result, guys, consult your healthcare provider for a blood test. So what causes these falsely low, now we're talking about falsely low A1C results. The A1C test can sometimes show a lower than actual result in certain conditions or situations. These include alcohol use disorder, blood transfusions, chronic kidney disease, using erythropoietin-stimulating agents, ESAs they call them, hemorrhaging, which is bleeding, living at high altitudes, taking iron supplements, having cirrhosis of the liver, pregnancy, as we discussed before, sickle cell anemia, and specific types of anemia like serocytosis, which is a sphere-shaped red blood cell, and hemolytic anemia. These conditions can impact the health and lifespan of red blood cells or affect the test's accuracy, leading to a false low A1C result, guys. If you have any of these conditions, your healthcare provider may consider additional tests to confirm your average blood sugar levels. So what happens when you have a false high A1C result, guys? So this is the high, it's falsely high, right? The A1C test may sometimes show a higher than actual result in certain conditions or situations. These include anemia, which is a reduced red blood cell count caused by iron deficiency, infections, and tumors. Certain medications such as immunosuppressants and protease inhibitors can also cause falsely high A1C results. Hypertriglyceridemia, which is high levels of triglycerides in the blood, organ transplantation, thalassemia, which is a blood disorder, and vitamin B12 deficiency can also lead to inaccurately high A1C readings, guys. Just because I have a medical background doesn't mean I can pronounce all this stuff. I'm not the only person who has a hard time pronouncing this stuff. And some of these words are pretty difficult words. So these conditions can affect your health, lifespan, or production of red blood cells, causing discrepancies in your A1C results. If you have any of these conditions, your healthcare provider may use other tests to confirm your average blood sugar levels. So what about if you have high A1C and you don't have diabetes? I bet you guys didn't see this one coming, because that's a pretty valid question, right? So if your A1C level is high and higher than 6.5%, it doesn't necessarily mean you have diabetes. Factors like specific medications such as steroids, illness, anemia, and other conditions temporarily raise your blood sugar. Additionally, issues in the test collection, transport, and/or processing can lead to a falsely high A1C result. Doctors use multiple tests like fasting blood glucose or repeat A1C tests to diagnose diabetes. They will thoroughly review your result and discuss them with you. So, should we consider A1C an accurate representation of diabetes management, guys? Meaning, does A1C tell the truth? Does it really say that I am Mr. A1C managing my blood sugar correctly over the last 3 months? For many years, A1C has been the primary tool for both healthcare providers and diabetes patients to assess diabetes management. However, the results can be misleading, especially for type 1 diabetes, due to its fluctuating nature over days, weeks, and months. A person with frequent blood sugar shifts between high and low levels can still have a 7% A1C. Similarly, a person with consistently stable blood sugar around 154 megagrams per deciliter would also have a 7% A1C. Recently, continuous glucose monitoring systems or devices have introduced what's called time in range, TIR, a more precise measure of diabetes management. TIR indicates, which is time in range, indicates the time spent within recommended blood sugar levels expressed as a percentage. While the target ranges may vary, a typical target for adults with type 1 or type 2 diabetes is between 70 and 80 milligrams per deciliter for over a 70% of a 24-hour period or day. So those continuous glucose monitoring systems and TIR enable better tracking of high or low blood sugar episodes, allowing for more accurate adjustments to treatment strategies. I had to research this because I don't wear a glucose monitoring system because I'm able to manage it without one. But if you do, this is probably valuable information for you. So seeing an unexpected or abnormal A1C results can be anxiety provoking, guys, right? But it doesn't automatically mean diabetes. Various factors might lead to inaccurate results. Consult your healthcare provider to determine if additional tests are needed. Don't hesitate to ask questions as they're there to support you. So if you've been diagnosed with diabetes, keep in mind that your A1C reflects a temporary average of your blood sugar levels. You can take action to modify your A1C levels, like I have. If diabetes management feels overwhelming, guys, discuss it with your healthcare provider to develop a strategy to better approach your management and A1C objectives. Now let's take a look at my past and recent A1C results from last week. So we'll go a couple years back, look at my past and see how I've done. So first thing we want to look at is this test here. This test was done on February 3rd of 2022. So we're going back to 2022. I can't, in the system, I can't get the older tests, which were way higher. I mean, that's when I really had diabetes. But let's see what I ended up here. It says my glycated hemoglobin A1C value is 5.3. So that means I was doing good at 5.3 in 2022, in February of 2022. And that's, you know, I was trying different things. Like I said, this channel is about me sharing what I've tried with you guys so you can try it as well. And it seems that I was able to find success trying certain things, but I still wasn't sure at the time. I didn't know for sure, but I did have a good A1C at that time by trying the things that I've been trying. And of course, the reference range here for a good A1C is 4.2 to 6.3 for the lab. So let's go to another date here. Let's go to, okay, August 16th of 2022. So this is a few months after. The first one's February of 2022. This is August 16th. And it says my average glucose, according to their test, was 117. So I was struggling to keep my average glucose down. And their reference range is 80 to 137 for average glucose. But my hemoglobin A1C went up. In February it's 5.3, and here it's 5.7. Right? So normal, less than 5.7, according to this, prediabetes is 5.7 to 6.4, and diabetes is anything greater than 6.4 here. Right? I'm at 5.7. Why am I 5.7? Because I'm at this point where I'm still trying to figure things out. If I would have known what I was doing back then, I would have started making YouTube videos back then. But I didn't know, so I didn't want to share erroneous information or wrong information with you guys. So my A1C fluctuated until I figured out what I was doing. So that is August of 2022. So let's move on and get a little bit more recent here. Okay, we're looking at March 31st, 2023. So another year through. I'm doing better now. My average glucose, I've gotten it down to 108. That is my average glucose, 108, which is under 110, which I'm very happy about, right? But look at my hemoglobin A1C. I'm getting it back down to 5.4, guys. So I'm doing great, right? I'm moving in the right direction. And the key is you're going to have some ups and downs like anything else, guys. I think the key is having more downs than ups if you're type 2. So I was at 5.4 in March 31st of 2023. Okay, let's go to a more recent lab here. And all of this I'm showing you guys to show you that I know what I'm talking about. I'm experiencing the same things you're experiencing, and I'm doing the same things you're doing. I'm a little bit disciplined about it, and I try to find some consistency in what I'm doing so I can share it with you guys. So now we're talking about January 31st, 2024. So we're talking about this year, guys. In January, the end of January here. My average glucose was 108. which is still good. It's under 110. I'm not complaining about it. And my hemoglobin A1c was 5.4. So it stayed the same. I'm happy about that. As long as it didn't go up, you know, I'm always happy about that. I'll tell you guys, my hemoglobin was up there. It was way up there. And I just can't show it to you because I don't have the records to pull it up in the system. They don't have it for whatever reason years ago. But you can see I'm making progress. And that's January. So that's probably before I even started these YouTube videos. I started these YouTube videos April, I believe, April or May of 2024. So I think we're going to go look at my most recent. So here's the last one. I took this last week, my most recent one. 7/25/2024. July 25th, 2024. What do I have here? An average glucose of 105. Yay for me, right? Because I went down 3. I went down from 108 to 105, which is good for me. As long as I'm under 110, I don't care, to be honest with you. But what I care more about is my A1C. But look at my hemoglobin A1C, guys. 5.3. I'm moving in the right direction, guys. But to be honest with you, she already in January reversed my diagnosis, my doctor. So at this point, she's just monitoring me to see if I'm going to mess up. And I'm not going to mess up. That's not me. And you're not going to mess up either. Because once you understand the secrets, you'll be able to enjoy all the foods that you normally would enjoy with small modifications. You can still eat the foods. It's how you eat the food. It's when you eat the food, you know, those kinds of things like glycemic index, glycemic load, all that kind of stuff. You'll be able to do it just like me. I do it and I'm confident about it. And to be honest with you, I was a little anxious about my A1C that I did last week because I stopped from January until now, which is the 31st of July. This is the 31st of July I'm doing this video. So between January and now, last 6 months, guess what? I haven't checked my blood sugar. I stopped checking my blood sugar, guys, because my next test for myself was, okay, if I continue to eat the way I'm eating, do I need to check my blood sugar? And I stopped, and it's telling me that I'm continuing on the right track. And I think when you get to that point, you'll do the same thing too. I have a lot of faith in you guys, you know. It's just you need someone to point you in the right direction and give you the little tips that no one wants to share with you. Because no one shared it with me. It took me a long time to figure this stuff out. So now you know I'm a credible guy. I know what I'm talking about. I've got a medical background, plus I'm a diabetic, and I'm controlling my type 2 diabetes. And you can too. Follow my advice. Give me some feedback. Everything's not going to work for everyone, guys. What works for this guy is not going to work for the next guy, so on and so forth. But if you give me feedback, that's going to help me help you. So is there anything else I have for you? No, that's it, guys. So my results are an average glucose or blood sugar level of 105 and an A1C of 5.3 as of last week, guys. So that's it. Thank you so much, guys. Have a great day. I hope this gives you a little confidence that you can follow my advice and you can make it happen for yourself as well. Have a great day.